Have you heard of rectal prolapse? So what is rectal prolapse? Rectal prolapse is the rectum coming out of the anal canal. So the rectum is the last part of the large intestine. It is above the anal canal. So the rectum is a defecatory organ. It will store stools. So when the rectum gets filled with stool, you will get the urge to pass motion. So it's a defecatory organ. It helps in evacuating stools and storage of stools. So the rectum has supports all around, and when these supports are weakened, the rectum will come out of the anal canal. That is called as rectal prolapse. Most of the patients who have rectal prolapse, they are very reluctant or very shy to share their problems. So they may not come to the doctor because most of the time what happens is when the rectum comes out, it goes back inside by itself, or with gentle pressure it goes back inside. So that's why they don't perceive it as a big problem. However, they're shy to express the problem. So the rectum which comes out, it's a rectal prolapse. If it is left untreated, it can lead to complications. So it can patients can become incontinent. They may lose control on the holding capacity. They may lose control of holding the stool or gas. And most importantly, sometimes when the strain, the entire rectum comes out and it may not go back inside. That's the most dangerous thing which can happen. I have seen a patient who was an expat in UAE. The rectum, he had a very bad prolapse. It was not going inside, and he had to flew from UAE to India to get operated. So when this happens, now this is called as strangulation or incarceration. The rectum will become swollen so much big, and it doesn't go inside. It may compromise the blood supply, and it may become gangrenous. So patient become very sick, and they will need emergency surgery. This is the dangerous thing which can happen when somebody has rectal prolapse. So if you have a rectal prolapse, the simplest treatment is surgery. So there are two kinds of surgeries: the abdominal procedures and the perineal procedures. Abdominal procedures are done through the abdomen. Most commonly is laparoscopic rectopexy with the help of sutures or mesh or whatever, and a resection rectopexy. For some patients who are having constipation along with prolapse, they may need a resection rectopexy. That is part of the large intestine which is very redundant, that is removed along with fixation of the rectum. Rectopexy means fixing the rectum. The abdominal procedures are generally performed by laparoscopic method or robotic method, which are minimally invasive. The pain is very less after the operation. The hospital stay is very short, and they will recover very quick after the operation. The hospital stay is very short. For perineal procedures, which is done under spinal anesthesia, for patients who are not fit for general anesthesia or who are very elderly and who cannot tolerate a surgery like an abdominal procedure. In perineal procedures, the procedure is done from the below, that is from the anus. There are multiple surgical options which you can discuss with your surgeon. Treating rectal prolapse is very, very important. Don't neglect the rectal prolapse. Recently, I have seen a patient who flew all the way from some other state, from North Indian state. He was having rectal prolapse for 30 years. So he was becoming partially incontinent, and many a time he is finding difficulty to put it back. So somebody has told him about the surgery option, and he came to me to get operated. So rectal prolapse is a very simple treatment. Don't neglect it. It can become complicated. So the best thing is to plan your surgery, elective surgery. That is, go to a surgeon, a surgical gastroenterologist, or a general surgeon, or a colorectal surgeon. Get evaluated, get tested, and then get operated. The surgery is very simple, don't worry, and the recovery is very quick after operation. The best procedure for rectal prolapse is laparoscopic rectopexy or robotic rectopexy. Thank you so much. My name is Dr. Dattaram. I'm a senior consultant surgical gastroenterologist and laparoscopic surgeon practicing in Hyderabad. If you have any doubts about your rectal prolapse, you can always call us on 9895437059 and book an appointment and consult me. Thank you so much.